Good evening, Dr. Joshua. Today is week 9. The journal is about domestic violence. Okay, the first question is about the requirement to report domestic violence, if what to keep confidential, and if it's involved an adult. Okay, so first of all, domestic violence is a form of abuse. It's illegal, and one must protect, as a provider, we should protect our client from getting further harm. So, however, uh, one is not required to report an domestic violence of an adult if the adult don't want to be reported, and certain information must be kept confidential, and you cannot tell anyone else unless the client is informed or the patient is informed that you're going to do so. And you can always share information unless the client give you permission to do so. So anyway, that's something I have been seen often during my practice, during my nursing career. And either way, the victim or the perpetrator has, most of the time, they will feel, both of them, they will feel destroyed, scared, and because, the behavior mostly is due to not thinking the proper way, not knowing, how to react to certain things, to certain events, or sometimes, it's due to stress or familiar issues, stuff like that. So the best way is to provide them, to the appropriate authorities so they can get help. And the last question is about so how do you approach a perpetrator who want to change their behavior? First of all, the best thing to do is it's try to understand why he want to change his behavior, because it can be based on the perpetrator's history of physical abuse uh, in childhood, and also it can be from anger. So you have to try to understand, the history, what caused it, the cause of the behavior, and focus on how to get focus on how you can get him help, because other than the help won't be effective. And I find out also the best modality of therapy will be CBT, because it's like the client have to want to change himself, like the behavior, and also the behavior, and also to identify what the causes of the behavior. And also another thing, it's another form of treatment will be solution focus than the problem, meaning you have some people may benefit also from group therapy. And because not every therapy it's effective for anyone. So some may benefit from a group therapy, and also, like I said before, solution focus may be the best treatment, because it helps for the individual focus on the solution of the problem rather than the problem itself. And I guess that's all, and thank you. Happy holiday again.